Okay, so very good morning to all. Today is World Mental Health Day, and CRC Rajnandgaon has organized one webinar on this topic of mental wellness of parents of children with disabilities. So, as we all know, that we all are involved in taking care of children with disabilities, and we often see that the focus gets remain on the children themselves, and we often ignore the parents of those children who also at the same time face some mental health issues and difficulties. So today is very apt day to discuss regarding this aspect of children with disabilities in this aspect of mental health care. So before start coming to the main topic, let me talk a few words regarding the World Mental Health Day itself. So as we all know that World Health Organization and World Federation of Mental Health, they observe this World Mental Health Day every year on 10th of October. And the theme for this year was set by World Federation of Mental Health as mental health in an unequal world, and slogan that has been given by WHO is mental health care for all. Let's make it a reality. So what is the importance of this theme? As we all know that healthcare sector already, especially in our country, is not given that much importance, and there's a lot of deficiency, or we can say there's a lot of inequality in the distribution of healthcare, especially in cases of mental health care, where previously a few years back psychiatrists and psychologists and special educators were distributed mainly in the big cities. And nowadays they are coming to tier 1 and tier 2 cities gradually, but the thing is that the inequalities still exist. So during this World Health Assembly in May, government around the world recognized this problem and recognized the need to scale up the quality of mental health services at all levels. So as sir has already talked about that, this COVID-19 pandemic has made this issue more important, and we all know that everybody got impacted both psychologically and physically by this pandemic, especially a few group of people like frontline workers and those people who are living alone, homeless people, and those people who already had some mental health issue, pre-existing mental health condition, or pre-existing mental health vulnerability was there, so they got particularly affected. And the services, including health services and mental health care services, were also disrupted during the pandemic. Research has already shown that there is a deficiency in the quality of healthcare provided. The stigma and discrimination associated with mental illness lead not only to the problems that are faced by that person physically and mentally, but also affect their opportunities, educational opportunities, job opportunities, job prospects, discrimination they face at workplace, and also it affects their family members and loved ones, as we shall discuss in today's topic, the problems faced by parents of children with disabilities. So we all have a role to play to address these disparities and ensure mental health care for all. So today's theme, mental health in an unequal world, enables us to focus on these disparities and issues which perpetuate inequality in care of mental health care. So coming to the main topic, mental wellness of parents with disabilities. As we all know, sir has also talked that having a children with a disability, be it a physical disability or mental disability, is a condition of shock. So first reaction of parents is that of shock. They find it very difficult to cope up with this loss of dream of having an ideal child. So every parent has a dream that he will or she will have an ideal child. So that loss of that dream itself comes as a shock. And as we all know that any kind of disability, be it physical or mental disability, is lifelong, is a chronic condition. so it's going to stay. There's no any quick solution to that kind of disability or that kind of impairment. So we all know that chronic conditions of disability, whether physical or mental, make extra demands on parents, which leads to stress. Especially mother of children with developmental disability face a lot of mental health issues, including depression, anxiety, and they feel socially isolated also. Having a child with developmental disability is associated with increased odds of having mental health issues like depression, anxiety, adjustment disorder, stress related condition, neurosis related condition. All these are found commonly. These kind of a condition generally depend on the type of disability, the coping mechanism used by the family, this family support, the community support the family is getting. Before discussing the problems faced by the parents, let us first understand the concept of caregiver. Caregiver has been defined as any person who is involved in identification, treatment, prevention of any illness, be it physical or mental, and in the rehabilitation of that condition. So, parents in case of children with disabilities fit this definition, and in most of the cases the caregiver role is played by the parents, especially the mother, except in few cases where parents themselves are not there, they are not alive, or they themselves are physically or mentally ill, or not able to give that much of time to that child. In those cases mostly grandparents are there who take care of that child. So parents stay with the child from day one. They know about everything about the onset of those symptoms, how the problem started, how the development got progressed, or how the development got delayed. So identification part is played by the parent. They are the first one to bring the child to the notice of any mental health professional, be it psychologist or psychiatrist or special educator or occupational therapist. So they are the ones who initiate the treatment, and they are the one who are generally responsible for the follow-up care. So, what are the problems that are faced by these parents or the caregiver of children with disability? First, most obvious thing is dealing with the disability itself, be it a physical disability or a mental disability. Physical disability, be it a vision impairment or hearing impairment or any locomotor disability, locomotor impairment is there, loss of any limb is there, impairment of function of any limb is there, be it any physical disability. Dealing with disability itself is stressful. Be it mental disability, it may be intellectual disability, gross developmental delay might be there, or autism like symptoms might be there, or specific learning disability might be there. So all these problems themselves lead to a lot of stress in parents. The disability in children lead to change in the lifestyle of the whole family. They have to modify the lifestyle according to that child, according to the needs of that child. There's change in the quality of life is there. Treatment in many cases, especially in like in case of physical disability where some surgery might be needed, or in case of like hearing impairment, cochlear implants are there, or vision impairment, some eye surgeries are there. All these treatments are very costly, be it any prosthesis, or even in case of psychological or intellectual disabilities, providing counseling to that child, continued therapy itself is very costly. So cost of the treatment, side effects of many medications, like children having some cerebral palsy is there, they are taking some medication or anti-seizure medication. All this medication cause a lot of side effects, so facing the difficulties caused by those side effects. These are the problems faced. Apart from that, social stigma is faced by the family and the parents. So as we all know, in our society, people with some disabilities, they were previously in Hindi, they used to be called as apang. है ना. So now the word has been changed to Divyangjan. So so the thing is that previously they were used to be seen with stigma and discrimination. The idea was previously that that person is having some disability because he has done some sin in past birth or something like that. But now the concept has changed, and these people are just seen as being differently abled. So parents themselves have to face a lot of stigma and discrimination because of being a child, because of being a parent of child with disability. Many myths and misconceptions, as I already told, that was previously associated with the illness. Still in rural area and tribal areas, people who do not have that much scientific temper, they still consider disability as some punishment given by the god, or some sin that has been done in the past, or some black magic. All these kind of things are still there. So these are the problems faced by the parents. So what burden these parents face? Burden has been defined as physical, psychological, emotional, social, or financial problems that are experienced by the family members or parents of the person having some disability. So the burden can be physical, like a child with cerebral palsy cannot walk, so the parent has to lift that child all the time. Like psychological, emotional stress is there, as we have already discussed, leading to depression, anxiety, somatic symptoms. All these kind of things are there. Social burden is there, where the mother has to put all her time in taking care of that child, and she has the loss of job is there. She might be previously employed or doing some work, she has to leave all that work. So she cannot attend the social functions or all the social activities because she has to take care of that child. So financial problems are also there. This loss of employment is there. But a lot of treatment cost is very high. Um, Transporting that children, taking him, traveling with him also becomes very costly in case of children with disability. So these burden are experienced by the parents. That these can lead to psychological stress, leading to neurotic like symptoms like insomnia, headache, irritability, depression, anxiety, and adjustment disorders. All these kind of psychological condition can prop up. Social and leisure activities, as I already told, becomes restricted. It becomes very difficult for the parent to leave that child alone because he or she is not able to take care of himself. So it becomes a all day 24/7 duty to take care of that child. That leads to a lot of social and social and community restriction. Disturbances in the family routine, as we already discussed, it becomes the child with disability becomes the focus of everything in the family. Every routine, every activity has to be adjusted to take care of the needs of that child. So family income also gets reduced. Financial impact, we have already talked. A loss of job is there, loss of employment is there. Now, and let's understand the concept of objective and subjective burden. All we have discussed till now is mostly the objective burden. Objective burden is what that is observable, tangible cost, and that results from the disability. It is frequently reported as relatively concrete problems like some financial problem, some social problem, social disruption, occupational disruption, and disruption of other areas of family functioning. These are objective burden. But apart from objective burden, a lot of subjective burden is also there. Subjective burden is caregiver's personal appraisal of the situation and extent to which he or she perceives the burden, his or her own internal feeling, own internal stress. This subjective burden will be different in different parents. There might be two mothers who are having a children with intellectual disability, and one mother might be able to cope up better than the other one. The one who is not able to cope up better is facing a lot of subjective burden. These subjective burden is because of the characteristic of that parent itself, whether she or he is able to cope up with that, how she or he perceives that illness, how she or he perceives the stress they are facing. It includes the extent to which the patient's presence and behavior and dependency is perceived as sources of worry or strain. Like those parents having a lot of subjective burden might attribute everything, every problem they are facing in their life to the disability of their child. So this kind of attribution, over attribution, is also part of subjective burden. Let's discuss the factors that affect the burden of the parents. There are various factors that depends on the various attributes. First, let's discuss the attribute of children with disabilities that affect the factors related to the burden. First of all, the type of disability, whether it's physical disability or mental disability or both. Like in case of cerebral palsy, both mental and physical disabilities are there. So depending on the type of disability, the extent of disability, burden will be more. Depending on the diagnosis, whether the impairment is vision impairment, hearing impairment, locomotor impairment, or intellectual disability, or autism like symptoms are there, cerebral palsy is there, specific learning disability. Depending on the proper diagnosis, the burden will be different in case of different parents, depending on the age of the child, depending on the gender of the child. For example, like when the child is very young, like 2-3 years old, so the problems or difficulties faced will be different. And when the child becomes 7-8 year old, 10-12 year old, then the nature of problem changes. So it becomes very difficult to handle a child who is grown up and showing behavioral disturbances or temper tantrums or self mutilating behavior. It becomes very difficult to handle because the physical strength of the child also increases. In case of small child, it becomes relatively easy for mother to hold the child, to keep him or her safe. But in case of grown up, it becomes very difficult. So stress or burden also increases. In case of female child, when he or she when she starts menstruating, then it becomes very difficult to take care of the menstrual hygiene. So depending on the gender, the nature of problem changes. Specific symptoms of behavior which are associated with high burden and high stress on parents include uncooperativeness on the part of child, throwing tantrums, self-harm behavior, self-mutilating behavior, head banging or biting self. This kind of behavior becomes very difficult to handle. Hostile and aggressive behavior, as we have seen in some children with intellectual disabilities, become very hostile and even psychotic also sometimes. My apologies, some technical problem. So attributes of the parent which affect the burden on them. The coping style of the parents having maladaptive coping styles like denial, emotional over involvement, criticism, coercion, overprotectiveness. These are correlated with higher burden. And the parents having adaptive coping styles like of that of warmth, sense of mastery, positive attitude, these are associated with lower level of subjective burden. The relationship of the parent with child also has an impact on the burden faced by the parent. Like mothers are generally the most affected. Educational level also has an impact. Few studies have found that those with lower socioeconomic status or lower educational level have more burden, but few studies have contradictory results where parents with higher educational status, higher socioeconomic status face more subjective burden. Maybe because they have more expectation from their child. Age and gender also has some effect. Like young parents have different kind of difficulties, and older parents face different kind of difficulties. Mothers generally face more difficulty. A minority community also face more difficulties, more stress, because of lack of social support they get from community. Attributes of the disability itself, the duration, what is the duration of disability. Longer the duration, more will be the burden, more will be the stress. And new caregiver have who have not previously managed this kind of illnesses have generally face more burden and more psychological stress. Depending on the nature of disability, we have already discussed, depending on the need and frequency of hospitalization, burden will be more. Depending on the environmental and social attributes, burden will have an impact on the parent. Like when social support, adequate social support is available, whether from family or friends or relatives, so burden faced will be less. The availability of healthcare facilities, be it any hospitals or therapy, we have Composite Regional Center in Rajnandgaon, CRC is there. So all kind of facilities are available, but these kind of CRCs are very less in the country. So parents have a lot of difficulty in finding appropriate therapist, be it occupational therapist, clinical psychologist, special educator. So availability of healthcare facilities, or any other doctor, eye doctor or ear doctor or psychiatrist. So depending on the availability of these kind of mental health resources, the burden will be perceived more or less by the parents. Government schemes, policies, whether they are there or whether they are implemented properly or not, whether the benefits are reaching the end person or not, all these have an impact on the mental well-being of the parents with disabilities. Community attitude and support also have a lot of impact on this kind of mental health issues faced by the parents.